Hey everyone, licensed midwife Catherine here again to talk to you about something that I love talking about and I want you to learn. So here goes it. I get questions all the time about what is CFT. So that's where we're going. Now, I'm going to give you some really dense language at the beginning of this video, and then I'm going to talk in more plain, easy to understand terms for you. But I want to just get it all out there the way that CFT is talked about, craniosacral fascial therapy is talked about online. I want to just give you the common language that's used, and I also want to give you just the easy language that I use with clientele to help understand what this is. So I'm going to do some reading. So if you're seeing my eyes like bouncing back and forth, it's because I want to just read a little bit here as I explain. So craniosacral fascial therapy is the work of Dr. Barry Gillespie. Okay, so he created this modality based on the theory that the craniosacral and the fascial systems are not separate, but are one interconnected system, okay? CFT blends two modalities, craniosacral therapy and myofascial release therapy, into a single highly effective therapy, okay? The intricate system originates in the body's core around the brain and the spinal cord and extends through the body's fascial web, which surrounds and permeates every structure down to the cellular level. The theory is that a healthy system allows for the free flow of cerebrospinal fluid from the brain down the spine into the sacrum and into the connective tissue, the fascia, okay? So strain anywhere in that system may affect brain function and mobility. Our brains must expand and contract, and any restriction or damage to this motion, such as those due to birth trauma or head injury, can greatly affect our health and well-being. So CFT is designed as a gentle modality to unwind accumulated fascial strain, allowing optimal mobility and therefore better brain function. When the craniosacral fascial system is loose and open, there's optimal flow of cerebral spinal fluid to help nourish the body and cleanse toxins. So what is fascia then, right? Fascia is essentially the body's connective tissue. It provides a framework that helps to support and protect muscles and organs and the entire body as a unit. It's all-encompassing web found throughout the body that protects the entire body as a whole. It envelops organs, muscles, nerves, and even blood for protection from outside trauma. It supports the musculoskeletal system and allows us to perform functional activities like walking, jumping, running, or simply changing positions. Okay? So, here's the easy terms, all right? So the best way I describe fascia is it's like if you ever took home a raw chicken breast, and if you haven't, go grab one, okay, from the store and try this with me because it's fun to see, all right? So if you take home a raw chicken breast and you pull up that like thin layer of skin that's like on that raw chicken breast, you see this white fuzzy stuff. Okay? That white fuzz is fascia, okay? And essentially that fascia is like this web, like a net, all right? And it can get knotted up. So if I had fascial strain up here, if I'm using my sweater here as an illustration, if the fascial strain is up here, it can be pulling from down here, right? And you might actually feel more pain over here than you do up here, even though this is where the real fascial strain is. And so if we unwind that fascial strain, it can unwind in other areas. So the fascia, there's a deep front line to the fascia, and it can run from your tongue all the way down to your toes, okay? And so when we are working with babies and we're trying to help them, a lot of us are running to just snipping and clipping and, lasering these frenums, the tongue frenums and lip frenums and buccal frenums, we're running to just like get those obliterated or, you know, resolve them, when in a lot of ways, in a lot of like situations, that that frenum is actually being restricted, and it's actually tight because the fascia is tight. And that's not always the case. Sometimes it's a chicken and the egg situation. However, when we work on that fascial system, we help to unwind that fascial strain, and we help to release the tightness that can be found in those frenum. So oftentimes you'll see babies that have like really tight toes that are kind of crinkled up and stuff, and their toes are like that. I can mostly tell when a baby has like oral ties, because their toes are actually really kind of restricted too. So I've seen some incredible work doing CFT with babies. I've seen working on babies and having them unwind their fascial strain in my arms. I can mostly tell the way that they were born simply from the way that they unwind themselves in my arms when I'm working on them doing fascial unwind work here. So essentially that's what CFT is, that's what fascia is, that's what the work is, and what it can look like and how it can help with some of these issues that your baby might be experiencing, or maybe you are experiencing. And my suggestion, if you want to learn more about what CFT is and how it's been working for my clientele, I want you to head over to my Instagram, which is at Catherine DeVoe Midwife, and you can check the highlight reel about CFT testimonials. And there's a lot of people in there that give their testimonies of how this work has helped them, helped their babies. One mom I worked with, her baby was born with an insanely misshapen head, so it was like slanted to one side. We have worked on that baby for about 12 sessions now, and the difference between day 5 after birth to now is incredible, just seeing what has changed for this baby. And she's allowing me to do more and more work on her as we grow in that relationship with each other and grow doing that work, and it's just been incredible. And so I want you and your baby to experience that freedom too. I want to see nursing and latching issues I want them to be resolved, and I want you to experience freedom. And so send me a message, ask me a comment, just do whatever. But yeah, feel free to check it out and hopefully find a provider in your area if I'm not in your area. So yeah, have a good day.